Imagine being unable to sleep because the minute you close your eyes, you hear noises like this, and the convoy in front of you is engulfed in flames. Imagine being unable to go bowling with your friends because the loud bangs trigger flashbacks to the sounds of mortars bombarding your camp. This is the reality for soldiers across the world who come back from war and suffer the effects of PTSD. Thankfully, with the help of virtual and augmented reality, soldiers are finally getting effective treatment for PTSD and won't have to face these issues much longer. And this is just one of the many health applications the technology has.
Since the development of methods of electronic communication, clinicians have been using information and communication technologies for the exchange of health-related information. However, the emergence of new shared media, such as the internet and virtual reality, are changing the ways in which people relate, communicate, and live. eHealth, the integration of telehealth technologies with the internet, is the next logical step of this process. To date, some eHealth applications have improved the quality of healthcare, and later they will lead to substantial cost savings. However, eHealth is not simply a technology, but a complex technological and relational process. In this sense, clinicians and healthcare providers that want to successfully exploit eHealth need to pay significant attention to technology, ergonomics, human factors, and organizational changes in the structure of relevant health service. Join us as we take an extensive look into how the eHealth applications, virtual and augmented reality, can contribute to the delivery of state-of-the-art health services. Virtual reality is the use of computer technology to create a simulated environment. Unlike traditional user interfaces, VR places the user inside an experience. Instead of viewing a screen in front of them, users are immersed and able to interact with 3D worlds. By simulating as many senses as possible, such as vision, hearing, touch, even smell, the computer is transformed into a gatekeeper to this artificial world. The only limits to near real VR experiences are the availability of content and cheap computing power. Augmented reality is the projection or addition of a layer of digital content into a real environment. AR has been commonly tied to image recognition or geolocation in the past, and was similar to the nature of QR codes, using an image rather than a black and white code to launch content or an experience. To grasp the difference, think of augmented reality as VR with one foot in the real world. Augmented reality simulates artificial objects in the real environment. Virtual reality creates an artificial environment to inhabit.
Given that distraction and other psychological factors influence the experience of pain, numerous interventions aimed to reduce the pain for medical procedures are based on distraction techniques. Patients report significant pain reduction when they allocate cognitive and attentional resources to this distractor stimulus. Past research has found that relaxation, hypnosis, cognitive tasks, movies, and nurse coaching all reduce patients' experience of pain. More recently, virtual reality has emerged as an innovative and very efficient distraction tool. In VR, a patient is fully immersed into a simulated environment by using a head-mounted display, headphones with environmental sound and/or noise reduction, and a head tracking system that allows the patient to naturally move in the virtual environment. Moreover, VR can be interactive so that the user is able to interact within the virtual environment to achieve a goal. The idea of using VR to reduce the distress of medical procedures was pioneered at the University of Seattle, Washington, where cognitive psychologist Hunter Hoffman and colleagues have developed a VR game called Snow World to help patients endure wound care for severe burns. Hoffman's team have shown in trials that Snow World reduces patients' pain during wound care sessions by up to 50%, as well as reducing pain-related brain activity. VR is now being studied by teams around the world to relieve pain in medical situations such as wound care and dentistry, as well as in chronic conditions such as phantom limb pain.
The VR and AR fields are still at the proof of concept stage, yet there is a growing number of potential clinical applications in the fields of physical medicine and rehabilitation that make effective use of VR technology. The determination of clinical impairment begins with a detailed physical examination and functional testing of the patient. The physical examination is designed to determine the presence of pain and any loss of strength, sensation, range of motion, and structure. Through research, it has been determined that both the neuro and orthopedic rehabilitation process can be enhanced through the use of VR technology. A clear advantage of this application is that a VR-based rehab workstation could be easily customized for individual patient functional rehab needs. The VR workstation uses VR technology to bring a feeling of immersion and realism to rehab protocols. A clinician provides a variety of artificial environments to facilitate rehab, ranging from very engaging and interesting to very realistic. An exciting aspect of VR technology is the inherent ability to enable individuals with physical disabilities to accomplish tasks and have experiences they would otherwise be denied. There are approximately 35 million people in the US with physical disabilities affecting their ability to work in certain types of jobs. VR has the ability to serve as an adaptable mechanism for harnessing a person's strongest physical ability to operate an input device for a computer program. One specific system showing this possibility is Data Glove technology. The Data Glove system allows users to record custom-tailored gestures and to map these gestures into actions. These actions can range from a simple command, such as clicking a mouse, to more complex functions, such as controlling a robotic arm. Pioneers in the field of medical VR are encouraged to design sophisticated devices that promote both physical and psychological gains for injured and disabled patients, while keeping costs for these devices within an acceptable range for healthcare providers and third-party payers. The mandate is complex, but like the VR technology itself, the possibilities are promising and exciting.
One of the most promising and practical fields for virtual and augmented reality is the use of the technology in helping soldiers recover from post-traumatic stress disorder. Virtual reality environments represent a unique method to immerse veterans in simulated military and civilian scenarios while monitoring psychological reactivity as part of exposure therapy. The technology integrates computer graphics via a headgear device that displays the VR environments directly to the veteran rather than on a computer screen, and visual and auditory stimuli that can be modified during the intervention. Psychological data can simultaneously be monitored during VR and stored using specialized software. Because of the strong association between PTSD and increased heart rate, cardiac acceleration, skin conductance, and more pronounced eye blink responses, VR may also be an effective tool to assess and monitor outcomes for PTSD. For those not familiar with PTSD, it is a condition which develops when a person has been placed under extreme stress or suffered a high level of trauma. A good example of this is a soldier who has suffered PTSD as a result of a frontline duty accident. Other examples include an accident, physical assault, terrorism, or the after effects of a major disaster. So how does this work in relation to PTSD? The affected person wears a pair of virtual reality glasses or a head-mounted display, also known as an HMD, and these contain two tiny monitors which display images of the source of their disorder, for example, a battlefield. The rationale behind this is that exposing someone to the source of their condition, combined with relaxation skills, will enable them to cope and adapt. As they are exposed to this over time, the level of threat is removed, which then decreases their anxiety levels and feelings of anxiety. Their physiological and psychological responses are monitored and analyzed as part of the treatment, and these responses are used to inform future developments in the technology. The person is able to revisit painful memories with the goal of developing new forms of behavior that will challenge their old behaviors and any other existing beliefs. This will cause them to learn new ways of thinking and behaving, which will positively impact their lives. The aim is for the person to lose any feelings of anxiety caused by their condition so they can lead a normal life. Unfortunately, results from uncontrolled open trials are difficult to generalize, and we are cautious not to make excessive claims based on these early results. However, using accepted diagnostic measures, 80% of the treatment completers in the initial sample trials showed meaningful statistical and clinical reductions in PTSD, as well as anxiety and depression symptoms. Additionally, anecdotal evidence from patient reports suggested that they saw improvements in their everyday lives. These improvements were also maintained at the 3-month post-treatment follow-ups. Other studies have also reported positive outcomes. 2 early case studies have been published that reported positive results using this system, and after an average of 7 sessions, 45% of those treated no longer screened positive for PTSD, and 62% had reliably improved. These results also outperformed the treatment as usual cognitive behavioral group approach.
Medical VR and AR is an area with fascinating possibilities. It has not just moved the imagination of science fiction fans, but also clinical researchers and real-life medical practitioners. Although the field is brand new, there are already great examples of the technology having a positive effect on patients' lives and physicians' work. For example, for the first time in the history of medicine, on April 14, 2016, cancer surgeon Shafi Ahmed performed an operation using a virtual reality camera at the Royal London Hospital. Everyone could participate in the operation in real time through the Medical Realities website and a VR application. Whether a promising medical student from Cape Town, an interested journalist from Seattle, or a worried relative, everyone could follow along through two 360-degree cameras showing how the surgeon removes the cancerous tissue from the bowel of the patient. Virtual and augmented reality could elevate the teaching and learning experience in medicine to a whole new level. Today, only a few students can peek over the shoulder of the surgeon during an operation, and it is challenging to learn the tricks of the trade like that. With a virtual reality camera, surgeons can stream operations globally and allow medical students to actually be there in the operating room using their VR goggles.
Have you ever laid down in a hospital bed, counting the days until you were released? Did you, as a patient, ever have the feeling that time just stops in the hospital? There's nothing to do, you miss your family and friends, and you are constantly worried about your condition. Brennan Spiegel and his team at the Cedars-Sinai Hospital in Los Angeles introduced virtual reality worlds to their patients to help them relieve stress and reduce pain. With the special goggles, they could escape the four walls of the hospital and visit amazing landscapes in Iceland, or participate in the work of an art studio, or maybe even swim together with whales in the deep blue ocean. Spiegel says that not only can the hospital experience be improved with medical virtual reality, but the cost of care may also be reduced as well. By reducing stress and pain, the length of the patient's stay in the ward or the amount of resources utilized can both be decreased. The experience in a hospital is even more stressful and mentally burdening for small children who miss their parents, their best buddies, their favorite blanket, and generally the soothing environment that we call home. Now, a Dutch company has made these children's dreams a reality. Through a smartphone and virtual glasses, the application Visit You makes live contact possible with a 360-degree camera at the patient's home, school, or a special occasion such as a birthday celebration or a football game. Though hospitalized, young patients have the opportunity to relax and still enjoy their lives.
Through medical VR, it might become easier for relatives and friends to maintain relations with their loved ones in hospital care. Instead of making lengthy drives to the hospital, there will be room for more quality time spent together. Did you ever wonder how it feels to grow old? How it feels not to be able to lift your hand above your head? How it feels when you've lost one of your fingers or had to recover from a heart attack? Embodied Labs created We Are Alfred by using VR technology to show young medical students what aging means. Everyone can be the hypothetical Alfred for 7 minutes and experience how it feels to live as a 74-year-old man with audio-visual impairments. The developers' ultimate goal is to solve the disconnect between young doctors and elderly patients due to their huge age difference. Fostering empathy between caretakers and their patients is much easier when physicians can see things from the patient's perspectives. These are just some of the ways that VR and AR are revolutionizing healthcare as we know it. It will be fascinating to see where the field goes from here.
Just have a look for yourself and see what these incredible technologies can accomplish.
Are you guys, I am inside the intestine. I'm looking at capillaries. Well, there's the wall of the intestine. I mean, this is just, I've never seen anything like this. I'm swimming around. This looks like a pretty good, now I'm inside a capillary. Holy moly, I am inside a capillary. Now look, I'm a hematologist by training, okay? These are blood cells that I deal with every day. There's a T lymphocyte. But now I can actually wait, there, where'd it go? Yeah. Oh wait, there it is. I mean, this is unbelievable. I'm seeing everything that I deal with on a daily basis, and it's all around me.
Now I don't know about you, but that seems pretty amazing to me.